Hey, good morning, everybody. Coach JJ here. Today is Friday, March 12th, 2021. And today's topic is going to be very short, and it's about COVID and the vaccine. Now, I've gotten a lot of questions and comments from folks that follow me and in the groups that I'm in, asking about, should I get the vaccine? Which one is the best one? Is my state ready for it? And just a bunch of questions. To those of you who have already received the vaccine, congratulations on being able to get that done for yourself. Good job in advocating for your personal health situation, making the decision to go ahead and do that. And definitely please let us know how you're doing. Keep us posted. I'm going to be watching because that's part of my job as a public health researcher. To those of you that have significant questions, it's really important for you to speak to your healthcare provider about this. None of us here on social media or in groups or anything like that can tell you whether or not to get the vaccine, because we don't know what your personal history is. We don't know about your allergies. We don't know about your co-occurring conditions. We don't know if you recently had COVID. These are things that we just don't know. The general advice is that if your healthcare provider recommends that you do this, you do it. It is important for you, though, to understand the health conditions that you have going on, whether it be diabetes, heart disease, certain neurological disorders, autoimmune disorders. It's up to you to understand what conditions you have and talk to your doctor about whether or not the vaccination is recommended for folks that have those conditions with your specific set of things that you have going on. It's up to you also to understand how your body works. The most important thing that I want you to remember, though, is that as an individual, as an adult, you have a choice. Bullying and coercion and gaslighting about this from healthcare providers, media institutions, and people in general, not acceptable. We can't be bullying and shaming people if they choose to not get the vaccine, and we're not going to be bullying and shaming people who choose to get the vaccine. And none of us can judge another person. We don't know what they have going on in their life. We don't know, what kinds of things have happened to them in the past. We don't know about their medical conditions. We don't know. So we're not going to be tolerating bullying, coercion, gaslighting, name calling, any of that stuff. I mean, if you go and talk to somebody and they say, well, I haven't been vaccinated yet. But first off, none of us really have business asking anybody else whether or not they've been vaccinated, because it's a medical thing. It's a medical decision. It's private between the individual and their healthcare provider team and whoever they choose to talk to. So we should not be walking around asking people, did you get vaccinated? Did you get vaccinated? That's going to create problems for people. We don't need to be guilting and shaming people that can't have the vaccine for whatever reason that they and their healthcare provider determine. Okay. Some folks maybe might intend on being vaccinated, but they want to wait a little longer. Or maybe they have to wait a little longer because they're not on the list of approved sets of populations in their state or county. We just don't know. Some people might be wanting to wait because they want to see what happens to the first sets of people that have had this done. There's certainly a level of kind of, uncertainty and maybe a little anxiety about it because it's so new and it happened so fast and things like that. As it stands right now, the data looks like everything is going fairly well. But there definitely are some subsets of the population that should wait. There are subsets of the population that are in the middle of undergoing certain kinds of immunosuppressive treatments and things like that, and they can't tolerate that hit to the immune system. And there are some people that have conditions where they should absolutely never receive this vaccine. And we're still waiting on more data. And because our individual health is our individual responsibility, we cannot judge a person for deciding to take precautions, provided that those individuals continue to follow the recommendations for physical distancing, wearing a mask, and doing things to help improve their immune system, including making sure their diet is appropriate. I hate the word diet, but nutrition strategy. Making sure that if they're deficient in vitamins and minerals, that they're taking supplementation, practicing hand hygiene, all those other things. But we shouldn't be judging people for this. It is very much a personal decision between a person and their healthcare provider. And really, at the end of the day, the person gets to make the decision. So that's my little public service announcement for today. Also, I am working with East Tennessee State University in conducting some COVID-19 research. I will post a link in the description and comments below. If you have already helped with the survey, I super appreciate it. Every little bit of data helps. If you haven't already, please check out the survey and please forward to your family, friends, and any people that you think might also take it and share. We're trying to get 10,000 responses within the next 6 weeks. Kind of a big ask, but I'm hoping that if everybody can help, we'll get it done. And this will lead to ongoing public health research regarding the pandemic and how we can best help communities in our local areas. So on that note, I thank you for spending the time listening to me this morning, and I hope you have an excellent day, and I hope that you are happy and well. Coach JJ out.